Hi, my name is Dr. John Paul Gallardo, and basically I wanted to go over a few points that should be important to patients when they think about gum disease and whether they have it or not, and also the level of importance that they give it in terms of treatment or how far they're willing to go to make sure that they have the healthiest mouth possible. So I look at it more from the lifestyle standpoint. Of course, as dentists, we want these patients to have healthy tissues. We don't want them to break down in the future. But the fact of the matter is, gum disease doesn't hurt. It's not painful. So unless you have signs and symptoms of bleeding or loose teeth, you're not going to even know you have it. So what I tell patients is, number one, prevention is everything. You want to make sure that you get right down to the root of the matter before it turns into or manifests itself into, God forbid, damage to the bone, damage to the actual gingival margin, or in terms of receding gum line and so forth. And worst case scenario is the teeth start loosening up. Once teeth start loosening up, not that it can't be reversed, but once you have loose teeth that you actually notice as a patient, where it's uncomfortable to eat, or when you put your teeth together, you notice that a few of the teeth are a little bit sensitive because they're moving around a little bit, or teeth have shifted out of position, you're starting to get flaring of the front teeth or gaps between the teeth. Usually when that happens, it means that you've gotten to a point where some of these changes might not be able to be reversed. So I talk about this in terms of not just health, but I also talk about it from the standpoint of just cosmetic, because it's going to look unsightly. Someone with receding gum line is going to have a smile that's going to look like maybe a decade older than what they truly are in age. Bad breath, is going to affect the social life of many individuals, and also just carrying around the fear or the uncertainty of whether you're going to lose teeth in your lifetime. And no one really, I interview patients, thousands of patients, and one of the questions that I ask them at every initial visit is, what do you think would be the best thing or worst thing about wearing dentures? And most patients will basically really hone in on the worst thing. And some patients actually get offended that I'm asking them. They're like, I'm not even going to answer that question. I don't want to talk about it. On to the next question. Because they can't face that potential reality. So it's so important to understand that a disease that really is so asymptomatic and something that sometimes can create such little in terms of symptoms or awareness or discomfort, that something like that could be so life-changing in the stages of the more advanced disease, where the changes could be completely life-altering. So that's what I share with patients.